Well, good afternoon, everybody. Welcome. It is the afternoon, first Friday in October. Can you believe it? It's October already, so we're glad that you're here. We love these first Fridays when we can come and invite you in and have some lunch and talk about topics that are interesting to you and to us, because that's really why we exist. We really exist for you. We really are here for you. We want you to get educated on your health care. We want you to know how you can feel better and do the things you like to do and have less pain and do more things and know the resources that are available to you right here in our area. There's a lot of resources available, so that's why we like to pick a different topic each month. Here at PRTS, at the Wellness Center here downtown, our topic this month is Parkinson's disease and Parkinson's awareness. So we have got a great Parkinson's program here, the LSVT Big program. It's been a phenomenal program for people with Parkinson's or with Parkinson's type symptoms to feel better, move better, gain a lot of function back. So that's our October topic. It's also Physical Therapy Month, so you get to hear a little bit of physical therapy stuff today from me. So welcome. Glad you're here. We're super interested in your health, and we know that you are too, and we know that's why you're here. That, and there's lunch as well too. Hope you were warmly greeted by our three witches at the front. I won't name them right now, but our three witches at the front. In fact, I've got to tell this joke. I got to tell this one joke. What do you get? What do you get when a witch goes to the beach? A sandwich. Thank you. That's the best I can do right there. So I hope you enjoyed your sandwiches today. Here at the Wellness Center downtown here in Hiawatha, we got a lot of things going on with our physical therapy clinic. We have our massage therapy with Betty Dvorak, who's here. If you have any massage therapy questions, she would always love to talk to you. We have our salon and our nail gals here, and personal care, which is our oxygen and CPAP company too, that we just enjoy being here to be a resource for you. If you have any questions, just let us know about those kind of things. Dave and Lori Noctigal are here. They always provide lunch for us every month. Thanks, Dave and Lori. Appreciate that. You enjoy those sandwiches, you know. Isn't that terrible? You know, I just heard that they're actually having a problem in Florida with the beaches. You can't go to them because of this algae stuff they're having. Wouldn't that be terrible to go to vacation in Florida and not be able to go to the beach? Okay. We'll get to our topic. I'll stop wasting your time here, but we're really excited. Speaking of resources, okay, the Northeast Kansas Area Agency on Aging is an excellent resource to you. They do way more than you probably even know. If you have questions about a lot of things, transportation, healthcare, insurance, you name it, they've got a lot of information out there that you can always call and pick up the phone or stop by their office and ask them questions. The other thing about this time of the year, it's October. What are our big topics? Well, flu shots and Medicare enrollment, right? So we're not going to talk about flu shots today, but you should get them. Medicare will be our topic today. Medicare is one of those kind of scary big things we always get nervous about with enrollment and what kind of coverage we're going to have and all those kind of things, but it's also there for your benefit. And obviously, Medicare provides great care for us to be able to access health care. So Karen and Rebecca have generously donated their time, and they're going to share a little bit of information with you, and mostly what they'll do is get any questions you have, particularly today when it comes to Medicare questions and things like that. So ladies, thank you for being here. Welcome. Take it away.
I don't know how to do that. So.
Okay. Well, I'm going to be in the way if I stand up here.
No.
Okay. Well, I would like to start off by saying that Rebecca and I are both new at this presentation. So the lady who was scheduled to do it had a family emergency, but we're we're going to do the best we can, and if we have to, we can take questions and we can get back with you. And we can do that on anything that we offer, not just Medicare. So if you have any questions outside of the presentation, now Megan did do the presentation for us, so we're kind of excited about that. So we're going to go through that. My name is Karen Wilson. I have been with the Area Agency on Aging for a little over 15 years. I started as the finance person, and I'm now the director. And Rebecca has been with us for...
Starting my 4th year, and I do office support. I also do navigator, and I'm now going to be a full-time SHIC counselor. So
she will doing a lot of open enrollment activities. So, okay, let's check out our system here.
Okay, we have Welcome to Medicare. You have some important decisions to make. This training is designed to help you have a better understanding of Medicare and to provide you with resources to help you make informed decisions. Your decisions will affect the type of coverage you get. Timing of this decision can be important as well. There are several decisions that at this time sensitive to ensure coverage and late enrollment penalties to avoid. You may have choices in which health care you pick and a prescription drug plan. President Lyndon Johnson signed the Medicare and Medicaid programs into law on July 30th, 1965. Medicaid became effective January 1st, 1966, and Medicare became effective July 1, 1966. The Medicare is the nation's largest health insurance program, currently covering the 44 million Americans. Medicare is health insurance for 3 groups of people: those who are 65 or older, people under 65 with certain disabilities who are entitled to Social Security disability, railroad retirement benefits for 24 months, or 24 months of Medicare waiting periods do not apply for these individuals with disabilities. With ALS, known as Lou Gehrig's disease, people with ALS get Medicare the first month they are entitled to disability benefits. The provisions became effective July 1, 2001. People of any age at the end-stage renal are automatically covered the first month after they're approved. Medicare has 4 parts. Part A, which is your hospitalization, and usually you'll get that. It comes free when you turn 65. You automatically get your packet and your card mailed. Part B is your medical insurance, which that's your decision to go through. I think this year we have 28-ish plans. So you'll go through and you'll read through, see which one. Some people pick Blue Cross Blue Shield, they'll pick Aetna, there's Cigna, there's Thrivent, there's many other options. So just what works best for you. Your Plan C are Medicare Advantage plans, and these are like HMOs or PPOs. We're starting to see a little activity in these in our area, but they're still kind of hit and miss. They're usually in the larger cities. And then of course your Plan D, which is your Medicare prescription drug plan. So the beneficiaries pay a late enrollment penalty for as much as 10% or 2 times the number of years without coverage. So usually what that happens is if you're coming from employer-based insurance and you wait thinking, oh, I'm healthy, I don't need coverage, I'll just roll with my A, and you wait, there's a penalty for like each month after the 90 days after you turn 65 if you don't enroll in a Plan B or a Plan D. And those fines stay with you from that time you enroll until you pass on to the greater beyond. So they never go away. So if your plan runs you $30 and your penalty is $8, you'll be $38, and each year it'll adjust whichever plan you pick. I don't have nothing for this one. I think I kind of covered that. There's your deductible this year. I don't know about deductibles. Most of the Medicare plans, B plans, start at about $147, and they go up from there. I think this year, coming in on Plan Ds, the plans start around $25, give or take, and they go up. So, if you're not automatically enrolled, you can choose to sign up for Part B during your initial enrollment period, which is 3 months before your birth month, the month of your birthday, or 3 months after. If your birthday lands on the first day of the month, then it's a month before. So actually, if you're the first, it goes in effect the month before that. You can sign up for Part B at any time during the 7 months. You can choose whether or not to enroll in Plan B. If you enroll, then you'll pay the monthly premium. Some of these premiums folks can opt to have deducted out of their Social Security checks, or you can actually get a statement in the mail and write your own and pay it. Social Security advises people to apply for Medicare within 3 months of their 65th birthday. Once again, you'll sign up 3 months before, up to the birth month, and 3 months after. If your birthday, well, here we go again. If your birthday lands on the first day of the month, the effective date will be the month before your birthday. If you aren't enrolled in Social Security or Railroad retirement benefits for the instance because of you're still working, then you will need to go ahead and have your A signed up. You can continue with your employer-based insurances until you choose to go ahead and retire from there. And there's no penalties for that. As long as you have minimal essential coverage, then when you decide to, if it's 6 months, 8 months, or 2 years later when you actually fully retire out, and then you sign into Medicare, there's no penalty for that either. Sorry. Medicare A is a premium free, and that your spouse, no one pays the federal insurance contribution or the FICA taxes while working 10 years minimum, which is 40 quarters. If either you or your spouse don't qualify for premium-free Medicare Part A, you may still be eligible for Part A by paying the monthly premium. The amount of the premium depends on how long you and your spouse have worked and paid into Medicare. Social Security determines if you have to pay a monthly premium for A, and in 2015, the A monthly premium was about $224. Up to $407 for those who had worked less than 30 quarters. So it's based on your 40 quarters of working in your life. It says if you do not buy Medicare A, then you are first eligible. You may have to pay a premium penalty also with that. And of course, with us, you can call us or you can call Medicare, the 1-800-MEDICARE, if you have any questions in regards to those penalties or to see what your premium would be. Decisions on signing up for Part B. Having coverage through your employer covers your medications. So that once again, as long as you're covered through your employer, then you continue on. It says you should contact your employer or union benefits administrator to find out how your insurance works with Medicare. If you have Medicare Part A and TRICARE, coverage for the active military or retired families, you must have a B plan to keep your TRICARE coverage. However, if you are an active duty service member or your spouse or dependent child is of active duty service member is on active duty, when the active duty service member retires, they must enroll in a Part B to keep their TRICARE. Part B premiums are deducted from your monthly Social Security, Railroad, or federal retirement plans. Amounts depend on your income, and there's forms for that also again. People who don't get retirement plans and whose payments are not received or enough to cover their premiums get a bill from Medicare for their Part B. The bill can be paid directly through credit, check, or a money order. If you don't sign up for the Part B when you're first eligible, there will be late penalties for enrollment from that to the end of time. Your monthly premium for Plan B can go up to 10% each full 12-month period you are not enrolled in a Plan Part B. You don't pay the late enrollment penalty if you sign up for Part B during the special enrollment periods. Sometimes you must have a Part B. Sometimes you must have a Part B. If you want to buy Medigap policy, if you want to join the Medicare Advantage plan, if you are eligible for TRICARE, if your employer coverage requires you to take it, then you have to talk to your employer about that. It says with veterans benefits, in addition, you must pay a penalty if you sign up late if you don't sign up during the initial enrollment periods. Having coverage through your employer or federal employee health benefits, or unions while you and your spouse or family members, if you're disabled, is still working, can affect your Plan B coverage. If you're covered through an active plan, you and your spouse, you have a special enrollment period. This means you can join Plan B anytime you or your spouse or disabled family member are working and you're covered by a group health insurance plan. Or during the 8-month period at the beginning of the month, the employment ends, or your group plan comes to an end. You should contact the employer or union benefits administrator to find out how insurance works with Medicare and if you would like to take advantage of delaying your Part B enrollment. If you don't take Part B when first eligible, you may have to wait to sign up to the annual general enrollment period, which runs January 1st through March 31st of each year. Your coverage will be effective July 1 of that year. If you don't take part in Plan B when you are first eligible, you will have to pay the premium penalty of 10% for each full 12 months you're not enrolled in a Plan B plan. When you have original Medicare, you and your red, white, and blue card, the Medicare card shows the Medicare coverage.
Sorry, I didn't know it did that.
Part A, hospitalization covers, and Part B is your medical coverage, and the date of coverage starts. Note the card may look similar to these on the board, and we just got our new ones all in, and to throw in here real quick, we are doing laminations of the Medicare cards, and we do that right now for $1 donation for the laminate itself. So you can come out anytime and we can laminate your cards, because it's like a one-time thing, and then they're expecting you to hang on to them. You can get replacement ones. If you choose another Medicare plan, your plan will be given you a card. Those numbers are not personal identifications no more. They don't have your social security number. They're just a bunch of random numbers that the computer will locate you in the system. If you choose another Medicare plan, your plan may give you a card to use when you go to health coverage and supplies. You can contact Social Security or your railroad board if you receive railroad benefits or any information about the card is incorrect. If you don't want Plan B, follow the directions and return the card. You will talk about why you might not want a Plan B later. Plan D is available to all people with Medicare. You can just have Part A and have a Part B, or you can have both. You can live with the plans, live in your plan service area. You can't live outside the United States. You can't be incarcerated. You must enroll in a plan plan yourself in most cases by completing the application. Some people are limited income and resources are automatically enrolled. So joining Plan D. You can join a Medicare prescription plan when you first become eligible for Medicare. During the initial coverage election period, which begins 3 months immediately before your first entitlement month or your birthday month, prescription plans must remain with the plan for the rest of that calendar year. And there are some exceptions to this. If you happen to have a low enough income, then you would qualify for extra
help.
Extra help. I'm taking extra credit. Extra help. And then in those cases, if it's not working, you can change those plans every month or every other month, so you're not necessarily locked in if your income is low enough. It says you can enroll in Plan D during the October 15th through December 7th of each year. You can choose a Medicare Plan D during the open enrollment periods. There are new annual disenrollment periods which begin in 2011. If you make this change when you join a Plan D, you can add drug coverage. Coverage begins the first month of the month following your enrollment. Certain situations may get you a special enrollment period. Permanently move out of a providing service plan area. If you lose your credible prescription drug coverage through your employer or other insurance, if you're not adequately informed on how your coverage was not credible and that the coverage was reduced so that you are no longer have coverage. When you enter, reside reside in or leave a long-term care facility or a nursing home. If you qualify for extra help, you have continuous special enrollment periods that can change your Medicare prescription plans at any time, or in additional circumstances such as you no longer qualify for extra help. If you choose not to join a Medicare prescription drug plan, your first opportunity, you may have a higher monthly premium penalty if you decide to enroll at a later time. The penalty is added to the premium amount. It is calculated by multiplying 1% of the national based beneficiary premium for the number of months that the person is not enrolled in a plan. The base beneficiary premium is $33.13 in 2015. Is a national number that can be changed each year. The average member premium reflects the special pay-by-pay premiums and the actual number of people who are enrolled in each plan. People who have other sources of drug coverage through a former employer, for example, may choose to stay with the plan and not enroll in Medicare prescription plans. If the other coverage is at least as good as Medicare prescription plans and is called credible. You will not have to pay a higher premium later if you choose to enroll in a Plan D. Some examples of coverage that may be considered credible include the following: group health insurance plans, state pharmaceutical assistance programs, VA coverage or military coverage included, TRICARE. If you don't agree with the late enrollment penalty, you may ask Medicare for a review and reconsideration. You'll need to fill out the reconsideration request. That is, your drug plan will be sent to you, and you will have the chance to provide proof that supports your case, such as information that previous credible coverage. Medicare Advantage Plan C are health plan options that are approved through Medicare that are offered in many areas of the country by private companies that sign a contract with Medicare. They are part of the Medicare plan. Medicare plans are set amounts of money that are private health insurance, private health plans for their members. In a Medicare Advantage plan, you may have to use a doctor or hospital that belong in the plan or in a network. You still have Medicare rights and protections. You still get all your regular Medicare coverage A and B services. You may get additional benefits offered through these plans, including Medicare prescription drug coverage. Other extra benefits could include coverage for vision, hearing, and dental, and/or health and wellness programs. Benefits and cost sharing may be different than the original Medicare, but in all plans, you usually pay deductibles, co-pays, and co-insurance for these plans. There are 5 main types of Medicare Advantage plans: Medicare Maintenance Organizations, or HMOs, Medicare Preferred Providers Organizations, PPO plans, Medicare Private for Service, which are PFFS plans, Medicare Special Needs plans, HMO point of sale plans, and Medicare savings accounts. There are things to consider when deciding if you want to join a Plan D plan. Most offer comprehensive coverage, including Plan D drug coverage. Many require that you use a network, that you must pay a monthly premium for your plan, still must pay a Part B premium. You may need a referral to see a specialist. You can only join or leave a plan during certain enrollment periods. Don't work with Medigap policies, and must have an A and B to join a Plan D.
Advantage.
Medigap. The Medigap Medicare insurance policies are private health insurances that cover only the policy, not the spouse. They are sold by private insurance companies to supplement original Medicare. This help pays the gap in original Medicare coverage, like deductibles, co-insurance, and co-payments. These plans are Medicare-covered services provided by a doctor, hospital, or provider that accepts Medicare. The exceptions in Medigap select policies that require you to specific hospitals or in some cases specific doctors to get full coverage benefits. Medigap may cover certain things Medicare doesn't depending on the Medigap plan. In all states except Massachusetts, Minnesota, and Wisconsin, Medigap plans must be one of the standard plans A through N so that they can be easily compared. Each plan has a different set of benefits that are the same for the insurance companies. It's important to compare Medigap policies because costs can vary. A Medigap plan only works with original Medicare, not with Medicare Advantage or other Medicare plans. It is illegal for anyone to sell a Medigap policy if you are in Medicare Advantage plan unless your enrollment has ended. You have Medicaid unless Medicaid pays for your Medigap policy and only pays for your premium Part B. Already have a Medigap policy unless you've canceled your old one. You may want to drop your Medigap policy if you join a Medicare Advantage plan or other Medicare plan. Even though you are entitled to keep it, you can't pay for benefits that you get under the Medicare Advantage plan or other Medicare plans that you can't pay any cost sharing reductions. If you have an original Medicare and you have a Medigap policy, you can go to any doctor, hospital, or other health care provider that accepts Medicare. However, if you have a type of Medigap policy that is called Medicare Select, you must use specific hospitals and in some cases specific doctors to get your full coverage and benefits. Usually the best time to buy your Medigap policy is during the Medigap open enrollment period, which begins when you both are turning 65 and you enroll in your Part B. There are 6 months Medigap enrollment periods, which gives you a guarantee right to buy a Medigap or Medicare supplement insurance policy. Some states may have longer periods. Once this period starts, you can't be delayed or repeated. You can buy a Medigap policy whenever a company agrees to sell one. However, there are many restrictions. You can shop for these plans at ksinsurance.gov. You just type in and go, and they'll answer questions, just show you the plans available, and we can help you if you want to come out. Next, sorry. These are programs available to help people with limited income and resources paying for Medicare costs. These include Medicaid, Extra Help, and Medicare Savings Program plans. This kind of shows you if you fall into the income to see if you have Extra Help or you fall into different categories for QMB, which is qualified Medicare beneficiaries. Low income, expanded low income, or Medicare Part D subsidies. These are kind of the guidelines, and I think they're printed in your packet to show where you're at, so if you can see if you qualify for Extra Help. And people with Medicare who have limited income and resources may be able to get Extra Help with the cost of Medicare prescription plan coverage. You must be enrolled in a Medicare prescription drug plan to get Extra Help. You can apply with either Social Security or your state Medicaid program office. When you apply, you can ask for information about your income and resources, and you will be asked to sign a statement that answers are true. Social Security will check your information from computer records at the Internal Revenue Service or other resources. You may be contacted if more information is needed. When your application has been processed, you will get a letter telling you that you qualified for Extra Help. Certain groups of people automatically qualify for Extra Help and do not have to apply. People with Medicare and full Medicaid benefits, including prescription drug plan coverage. people with Medicare who get supplemental Social Security income, people who get help with Medicaid paying their Medicare premiums, and all people with Medicare must file an application for extra, the other people will have to file an application for extra help. You fill out a paper application, it's submitted to the Social Security office, you go through the state Medicare assistance office and your local agency helping you, and then someone can help you on your behalf. It's a fairly easy, quick form. Decisions to make. Now that we reviewed your options, it's time to make some decisions. Should I keep or sign up for Part A? Should I take a Part B? And if so, when? What about a Plan D? Do I need a Medigap policy? Can I get help with Medicare cost? Here are some key points to remember. Medicare is a health insurance program. It does not cover all your health care costs. You have a choice in how you get your coverage. It is important to make the right decisions at the right time. There is help available if you're needing assistance. And of course, as we all know, we now have scams and fraudulent people calling. They seem to manage to get in on them local numbers even though they're not around us. If you feel you've been scammed or frauded, get a hold of the Social Security office. You can call us out to the offices, and we can proceed to get you covered and find out if it's been a scam and how we can get you covered. And scammers can steal your identity, file false claims on your Medicare number. That was the reason we all gone to the new 15-digit hodgepodge numbers, I guess. We always want to protect yourself, even though that's not your Social Security number on there. Hackers, or if someone wants to, they can always find out who you are, because if they've stole that, they may have had your wallet, your purse, whatever, with other identifying information in it. So do we have any questions? Oh, wait, one more slide, I guess.
One more. Those are the contacts.
Okay. More information and help is available. The Medicare and You handbooks. Some of you probably receive these every year. If you haven't turned 65 yet, they'll be being mailed to you. They come to every household every year in the fall. That includes Part C and D plans in your area. Other publications are available at Medicare.gov. Medicare helpline is open 24 hours a day, and you can call 1-800-MEDICARE. Partners can find information for the National Medicare Team Program at the kansasinsurance.org. Contact your state health insurance assistance program, or SHIP. Their phone number is on the back of the back cover of your Medicare book, the Medicare and You handbook. They're all here on the back. Presenters may wish to add local information. And we're located at 1803 Oregon Street, which is just before you get out to the Ford. And we're there usually Monday through Friday, 8 to 5. Someone's there. If you have questions, if we don't, we'll get right back with you. So at this point, do we have any questions? You can call on them.
I got hearing aids from the government. I've been in service for Second World War, and I've tried two other kinds that didn't satisfy me. These are pretty good.
Good.
And as I left, the lady that checked me out, I says, "What do I pay?" She says, "You were in the service. Yours are free." I get home 2 weeks later, and I got a bill for $450.
Well,
Isn't it a little late for us? I don't see anybody here under 65.
Well, you might have friends or relatives that are getting ready to turn 65, so
My daughter's 65 and she turns 66 next month. Is it too late for her?
no, is she currently covered on her employer-based insurance?
I imagine.
And she's probably still working. She'll be fine. She will get her packet in the mail, and then it'll have her card, and she'll automatically have A. And there's instructions in your packet that say if you want to postpone your plan B and D because you have employer-based insurance. So she'll just return the form or whatever's in it. I haven't got a packet quite yet. I'm close, but you can return those back in or call them and let them know that you've got coverage. They may ask for your policy plan or who your employer is.
She wants to retire when she gets to 66. Why is she waiting till she's 66?
It's based on, some people actually have gone in and set up the My Social Security account, and it'll show you, like, if you want to retire at 62, what your dollar amount each month will be. If you wait till 65, some people actually can wait till, like me, I'll be 70 to get my full benefits. So, I mean, as long as my health hangs in there and I'm able to work, some people will stay in it as long as possible because you get a little bigger amount if you hang out. The overall picture would be if you get, like, you sign up early, let's say you'll get $500, and that would be until the time that we all check out of this here world. If you waited an extra 5 months, oh yeah, I might get more, but you have less time. So what it is, I think it all works out in the wash in the long run. It's just if you can afford to take the lower amount earlier, if your health doesn't work or your spouse goes and you all want to retire and travel, or you can hang out and get the larger amount a little longer down the line.
I took mine out early when I was 62, so I don't get very much, but 65.
Yeah, there's a lot. I mean, it's a very personal decision. I mean, you know, I have a family member. He chose to work till he was 70. I'm not sure why, but he wanted to work. So, but some people are ready to retire earlier, and they're willing to take that smaller amount. It's very much a personal decision, and we kind of go over a lot of those different options. So, what's right for me is not going to be the same as for Rebecca. So we all have different financial situations, medical situations, and family situations that we really we all consider when we basically do any decision making. So we really need to. It's a personal decision for everyone. So as far as I know, I have people ask when's the right time. I said, well, there's not one answer for that. It's very personal.
I was hard up for money back when I was 62. I went to Social Security, and she sat down and figured it out. She says, you'll be all right. You have to live at 80 to gain it back.
To gain it back, yeah.
I'm on plan F, and that's what you're planning to do, is that any problem?
Well, it's kind of a catch-22. Once you sign into your B plan, providing that you're staying generally healthy, during the open enrollment periods, you can apply for a change in plans.
As long as you're healthy.
Well, it's up to each insurance company to say, yes, we will, no, we won't. So we don't advise anyone to jump and cancel a plan until they've been accepted into another plan. Obviously, I mean, we're not all going to be totally healthy, but I mean, the healthier you are, if you need to change a plan or if you're not getting coverage, the quicker you change that out, the better possibilities of changing your plan.
I took mine and F right from the very beginning. That was awesome.
And I believe, and I don't have the date in front of me, and I'm sorry, I think the Plan Fs will be, as I call them, expiring out here in 2021. So everyone will go to a G plan, and they'll automatically just roll you in. Our fair government thinks that we need to be paying a little bit more for our health care. So yeah, I don't know exactly the date, but I mean, I can get back with anybody that would like to know that. If you have a computer at home, you can go in. I know there's a set time frame, and it's still a couple years off. But what's happened is we have, like I said, the government thinks we need to pay just a little bit more out of our own pockets to cover our health care plans.
People who don't have it, and theirs won't be raised.
I don't know how they're going to raise them or not raise them. What I'm saying is they'll just get rid of F and everybody will be a G. So instead of, let's say, maybe you're paying 80-20 now, maybe the plan Gs will be 70-30. Right. Sure. That's usually the most popular plan when people go in. That usually covers the most and you have the least out of pocket.
I waited until I was 70, but I was fortunate enough to be healthy and working that. If
Right.
even at 60.
Right. And if you're working and have good, credible coverage,
They called me and said, you've got to now, if you're going to take it. You can get, you have to.
yeah.
I wasn't sorry, thank God. Like I said, I was very fortunate to have my health to work with.
Well, I think we have Brian sneaking up on us here. Real quick, we're coming into open enrollment for your Plan D. Starts October 15th through December 7th. We kind of advise folks to keep an eye on their plans. If you happen to have medications that are not being covered or you have a high copay on those, you can come see us during open enrollment. We'll plug in. We can leave these behind. They're basic forms you can fill out, bring in. We'll plug them into the system, and then we can shop plans, let you down and see what your premium could be, what's going to cover your pills the best. Maybe you change a plan every year. Maybe your plan's doing fine. We just advise you to take that moment during open enrollment time to say, hey, am I getting the most bang for my buck and my pills being covered?
Each plan can also change what they cover every year. So if you're happy with what you have and all of your medications coverage, we still recommend you look to make sure that it's going to be covered next year. And you can do that on your own. We can help you with it. You can call 1-800-MEDICARE. But it's worth it just to double check, just to make sure going into the next year.
All right, let's give Karen and Rebecca a round of applause. Thank you for your attention. That's a lot of tough information, and it is a personal decision. I like that point that you need to get informed and make your own decisions. Don't go make a blind decision that you're not sure about. Give these gals a call. Talk to people that you know if you have questions. And Betty, I'm not 65 yet. So. She said she didn't see anybody 65 around here, so I'm just kidding, Betty. Okay. No, but I only saw a couple people fall asleep. That was impressive. It's a lot of information, but it's very important. It can make a big difference financially and just coverage. So we really thank you guys for everything you do, for keeping up on the information that, guess what, changes every single year, if not every single month sometimes. So keep up reading those statements. Let your healthcare providers know if you ever have any changes in your insurance. That's also a very important thing. That when you go in, that's why we ask you all those questions sometimes, is make sure we know what your coverage is so that you are covered for the services we provide. It's nice that physical therapy is an example of a Medicare-covered service. And so we get to provide that with your Medicare. Okay, one last thing. If I could leave you with two things before you go. It's that time of year when the weather starts getting colder, when sicknesses start going around, it's easy to kind of hibernate up, right, a little bit and stop moving and not feel very good. So do a couple things for me till we see you next month. Wash your hands, okay? I'm serious. Wash your hands because there's more germs going around, and keep moving, okay? Whether that means just, we have exercise classes here if you have questions about that. Keep moving. Don't let yourself get weak and tired, and stop moving over the winter time. It's a very important key time to keep moving. So wash your hands and keep moving. Come back and see us next month, and thanks for coming. Appreciate it.